So putting it all together, and I appreciated the title about a practical guide. Considering pregnancy, you could think about this script in the consultation room with your doctor. And for the clinicians on the call or on the webinar, this is likewise a helpful framework to use when reviewing a woman's history and what her treatment is, and how to think through planning for pregnancy. So this was actually by colleagues who had published a paper on this, and I just thought it was such a great practical offering. So, something like, hi, doctor, I'm planning to get pregnant within the next year. I'm wondering, what are your thoughts on whether I should continue my long-acting methylphenidate? And the clinician could say something like, that's a great question, and there's no right answer. Which, by the way, can, I think, be frustrating for a lot of people. I think the wish or the fantasy is that there's the right way and then there's the wrong way. And so best to do the right. And so if it hasn't been already clear that, there is no risk-free decision. And at the same time, I think doing tailored individualized approach can really mitigate risk and come up with the best plan for an individual. So in this response from the clinician, they could say something like, it's best that we make the decision together, taking into consideration the severity of your ADHD and the potential negative consequences of you not taking your medicine, as well as compare that with a possible increased risk of, birth defects and or potential obstetric outcomes, like maybe high blood pressure versus other pediatric complications, maybe a need for a brief stay in the NICU, and then use that time as an opportunity to review the available data to date. And then, as the prospective pregnant person, you could say something to the effect of, well, what are some of those risks? And then the clinician can, use that time to review some of the recent studies that show potential associations between use of medicine and cardiac malformations, particularly ventral septal defects, maybe with methylphenidate. But again, the absolute risk is low. And one way we could thread the needle is by getting a fetal cardiac ultrasound. And I think it's worth noting and stating in the consultation room that there are a lot of confounding variables in these studies, which means that no study is perfect, and there can be confounds like the population being studied is very different from you. For example, you may not have any medical comorbidities, you may be a non-smoker, and there may be other variables that make your unique situation very different from the population that was studied and described in that particular research report. So then what about now that you're pregnant and or newly postpartum, how do we think through mitigating risk? So how do we sort of thread the needle between driving safety, impairment in fulfilling occupational and domestic roles, as well as minimizing risk of exposure unnecessarily to medications in pregnancy and in the postpartum. And so this is where really you can consider reducing your workload if that's an option. If you haven't already done CBT for ADHD or availed yourself of organizational skills or executive function coaching or training, that can be very important to do. Thinking through how to restructure your environment, linkage for support to coaching and or support groups, remembering that it's important to validate your experience and question the impact of societal expectation and practice self-advocacy. So with that, medication being a piece of it, but not the entire story. And so pregnancy is often a great time to optimize those other facets of treatment if they haven't already been done so to date. And then what about practical guide now that you're in the postpartum and have a young family? How can you take the best care of yourself possible? And this is where my message would be to double down on proven effective ADHD treatments. We know that motherhood and parenthood can be a time of incredible highs and lows, a lot of chaos, can be environmentally overstimulating. And that can lead to increased cortisol, which can have impacts on both ADHD symptoms as well as the comorbidities. So this would be a time, again, to really emphasize the prescription of exercise, considering home organizational support or organizational skills training, executive function coaching, mindfulness-based stress reduction, CBT for ADHD, as well as time in nature, regulating sleep, access to excellent nutrition, and practicing general self-care. And then finally, practical guide managing ADHD as a mother. I think it's worth noting that women of reproductive age with ADHD would benefit from working with a psychiatrist or a medical team who really is open to learning and or understanding, if they don't already do so, the impact of hormones on ADHD throughout the lifespan and the way in which it interacts with medication. So for example, as we discussed in the slide, with the brain and the estrogen and the dopamine, stimulants may be less effective during the second half of your menstrual cycle. And hormone replacement therapy can really improve ADHD symptoms in postmenopausal women. So these are factors worth considering, and hopefully points of discussion that you and your physician can have together, your medical team. And working with an integrated and informed and supportive healthcare team is essential and can lead to better outcomes for women.